How long does it take anesthesia to leave your body after a surgery? How long does it take contrast gel to leave your body after you have an MRI? You ever wondered? Ever ask yourself? I tell my clients all the time, just because you wake up from a surgery, they check your heart, make sure your heart is still beating, make sure you are conscious and coherent. And they used to make you have a bowel movement. I don't even think they do that anymore. But when the doctors are done, if your vitals check out and you are coherent, you are good to go. But that's not where the healing ends. That's not where the how your body snaps back after that. And here's an interesting story. My name is Michelle Dominique, certified wellness coach. I had a new client for lymphatic recently, and just the other day. And I called the next day to do the follow up, ask how everything was going. And she mentioned something about having pains in her stomach. And I thought, oh, yeah, okay, could be, a release of gas. If you've not been having regular eliminations, because of course, lymphatic drainage is a detox treatment. Okay, so that's not uncommon. But she said, no, these are really sharp pains. So that kind of made me think. I was slightly concerned because that's not normal. With women, I always ask, do you have your ovaries and all of that stuff, because cramping. And so I asked her, tell me again how it felt. And we determined it was like a zing, zip, zap, sharp. When you feel something like that, those are nerves. That is nerve pain. So understand that if you've ever seen plugged in something that had a short and it had that little zip, that's how it feels when your nerves are sparking, because your nerves are indeed your electrical system. It's your body's electrical system. Your nerves are powered by electrolytes, right? So that's why when you drink too much water without adding electrolytes, you can short circuit your system and actually die from that. But nonetheless, your nerves, those impulses are your body's electrical system. So when she told me that and I thought about it, the scar on her stomach, and I said, was that near the scar on your stomach? And she said, yeah, actually it is. And I said, you know what that is? So that's a sign that your nerves are waking up after the surgery. Waking up. It's that toxic load being released from your body, that anesthesia being released from your body, your nerve endings. Remember, I talk about this all the time. Healing doesn't happen when you leave the hospital, when you do your follow-up, when the doctor releases you to go back to work. Those are steps, but that's not healing. The body does not skip. It doesn't matter if you only had 3 weeks, 6 weeks, or 4 weeks off work. The body doesn't work like that. The body is not healed until it's healed. And if it's not getting the proper rest, the proper nourishment, the release of toxins, okay, that's where lymphatic drainage before surgery is so vital, because it helps to clear your detox pathways so that when you are released from the hospital and you stop having all of the heart, because you remember, you get the super drug is the anesthesia, which is necessary. You get the pain medication after. All of these things slow down your whole body, including your lymphatic drainage system. So when we did the session, opened up her drains, promoted her lymphatic flow, that residual narcotic effect that she had been functioning with and didn't even know it was gone. It started to release. It started to pour out. And guess what? her nerve endings. That's not the first time I've had that happen, but normally we were working towards that. This was a little different because that's not what we were working towards. But yes, so when she started to feel that sparking in her stomach, that zinging, I was like, yeah, that's your nerve endings waking up, because you do know they cut through nerve endings while they're doing surgery. It's inevitable. They have to, right? And so that was so exciting for her to, one, be able to understand what her body was doing, and two, be able to feel that sensation, because like I always say, I take pleasure in helping you to understand the signs and signals that your body sends you every day. And that was a sign that her body was sending her, that that area still is not healed. Now, the interesting thing about it, I'm going to ask you a question. Do you think she had that surgery last week, last month, 6 months ago, or longer? That surgery was about 9 months ago. 9 months ago. And she has just now started feeling sensation in that area. I don't know what else I can say. If you are planning on having a procedure, no matter how extensive it is, no matter if it's elective or cosmetic, no matter if it's dental, if you are going to receive any degree of anesthesia, if you are taking any kind of test and you'll be using dyes, contrasting dyes, or please schedule with me for a lymphatic session before. After, great, yes, definitely recommend it after. Even doctors are starting to recommend it after. But before is just as crucial, because if we can catch some things in the beginning, it will help your body come out of the surgery better and get to the healing, the true healing part better. Okay? Be sure to share this video with someone else, because they need to know this information, especially if they are having a surgery of any kind. Remember, any kind of anesthesia is considered a surgery. And also to be sure to schedule. It does not matter if you are not in the same town as me. I have people who are in the same town as me, and they still do virtual appointments because it's easier that way. It's more convenient, and that works better for them. So be sure to reach out. Once again, this is Michelle Dominique, certified lymphatic therapist and wellness coach, reminding you, you deserve to live your best, healthiest life, and I'm privileged to help you do it. Look for the next video and be sure to like and share.